First of all, I would like to thank Dr. Mohamed Al-Madid for his continuous support, especially for this Aspetar Current Concept. And without the support of our high authority, we couldn't achieve that kind of project. So my name is Philippe Landreau. I'm Chief of Surgery here in Aspetar. And good morning first. And I'm really happy to welcome you in this in Aspetar to organize this and to participate to this Aspetar Current Concept. Why did we choose the elbow after the first Aspetar Current Concept which was dedicated to the knee last year, and we had a good attendance, and we had a good success after this first edition. Why? Because we know that this joint is less frequently involved, and for sure this joint have received maybe less attention than the lower limb extremity athletes' injuries around the world, and probably more here because as probably the main sport here is football. I mean soccer for the American guy. And anyway, although this fact, elbow injuries can be just as debilitating to athletes who are practicing this kind of sport with overhead motion and throwing motion. And this is why we thought it was interesting to dedicate this meeting on elbow. And in Qatar, for sure, baseball player, which are big topic in our friend from North America, baseball players are not very frequent in this country. But we know that handball, I said handball and not handball, but handball players, volleyball, basket, racket sport players, gymnasts, and so on are numerous here. So it's a real current problem and frequent problem. I mean, frequent in the athletes field. And you know that because of its unique anatomy, this elbow joint is especially vulnerable to the repeated stress placed on the upper limb extremity, upper limb, in this kind of sport. And you know that the injuries can be, and the lesion can be acute, can be chronic, such as those caused by stress overload or repetitive movement. And it can involve bone, soft tissue, or both. So it means the pathology is, and the lesions are varied. So this is why you see, or you will see, I think, on the program, that the topics and the pathology are numerous. And this is why the program is quite, we will be busy during these almost 2 days to talk about this joint. So and you know that, and people coming from club doctors or from clubs or from teams and other, you know that an inadequate diagnostic and then inadequate treatment can cause permanent disability for these athletes, and sometimes can affect their career. So this is why we thought that it was justified to discuss and to take the time to discuss this less known, less studies, less discussed joint, the elbow. So to do that, okay, it was clear that we have to invite big experts from different parts. So we are happy to have some experts coming from Aspetar. So I mean, I could say we used their name and we used them to participate to this meeting. But we had to invite some people coming from other countries and welcome to this expert. And I don't want to introduce each participant, each expert, because you have the biography and the speaker profiles in your hand, and you will see that we have a very good faculty. And how we will run this meeting. You see that you know that we will have a 1 day and a half meeting. So today it will be quite busy because we will finish at 5 only. But we have a lot of topics, and tomorrow morning it will be lighter for the end, I mean. We divided this presentation in 5 sessions. You will see that some sessions are very generous, some others are less, but we thought that it was good to divide this session to facilitate the discussion. So the proposition is for each session we will have a chairman, and Chuck Cassidy will start, and we will present all the lectures without discussion, and we will manage and we will do the discussion at the end of the session. I think it will be better in terms of logistic and organization. By the way, feel free to ask questions. It's an opportunity for everybody. We have big experts. We have renowned experts here. It's an opportunity because tomorrow they will leave. And this is the time to ask questions, even if you think that it's a question from a child, no worry. We are here, the atmosphere is Aspetar is like that. If you don't hesitate to ask questions, if you are expert in elbow, ask expert question. If you are not expert, ask your question. They are here for that. And the objective and the aim is to make sure that you leave this meeting at the end with the clear idea, some clear ideas of elbow. This is the part of education, and at least it's one of our willing. So to encourage the discussion. So we can start now. I would like to ask first to the speakers to respect their time. So it means 15 minutes for each presentation to let enough time for the discussion. And I will let Chuck, my friend, to start up really this meeting, and I wish you a fruitful meeting. Thank you very much.